Everyone, I'm going to share my slides right now. So welcome to this great webinar about children with chronic spontaneous urticaria. Our next stop of discussion today will be calming the itch, effective strategies for managing urticaria in children. I'm Larissa Brandão, and I'm speaking from Brazil. I don't know if there are too many Brazilians watching us today, but I hope it does. So how can we calm the itch in chronic spontaneous urticaria? Well, we already had a great lecture about recognizing urticaria in children with Dr. Petra. So the optimal management of itch actually requires that treatment be tailored to itch and hives cause. But as you already saw, chronic spontaneous urticaria is a disease that is caused by autoimmunity mechanisms. So sometimes it can be difficult for us to tailor the treatment exclusively to itch and hives cause because the cause is an autoimmunity mechanism. So for that, we need some effective management strategies that are not just only one thing, but actually more than one type of strategy that we can see here, three steps that we need to follow to calm the itch. For example, the first one is to use the correct medication that is prescribed by your doctor and avoiding exacerbating factors and triggers, as already Dr. Petra said, and taking care of our skin barrier. So in the first step, we have the medication. And for us doctors, the overall goal of urticaria treatment is to help patients to be free of symptoms until urticaria is gone. Because as Dr. Petra said, this disease is not forever. It's an auto-limited disease. And for that, we can use and we recommend the use of non-sedating second-generation antihistamines daily. You may remember some different names like bilastine, cetirizine, bisloratadine, fexofenadine, and levocetirizine, for example, that can be used in standard doses to control the urticaria or even in up to fourfold the doses. But some children may not control their urticaria with this kind of treatment with antihistamines. And in this situation, you should talk to a specialist. You cannot stay alone in this scenario. We have some biologic drugs that are licensed for urticaria treatment. However, their license and their availability may be different in different countries, especially for children, because some of them are licensed only for children up to 12 years old, like omalizumab, for example. And today we already have the option of dupilumab. We also have other kind of treatments like immunosuppressant drugs, like cyclosporine, that could be used in those cases that children who do not have a good control with up to fourfold doses antihistamines. However, when we use immunosuppressant drugs, you should be followed by a specialist because this kind of treatment may be accompanied by some adverse events, and we should follow these children very closely. And in our very next future, we have other upcoming treatments that are still in study, and we hope that these treatments may be available for children in a very next future. You should also be aware that oral corticosteroids are not recommended for urticaria over the long-term use due to side effects. Like, for example, it may make your children have high blood pressure, or it can interfere in the final height of the children when they get older, or it can maybe make your children gain more weight. So this kind of treatment should be used only for treating exacerbations for short periods that should be up to 10 days. and always following the basic principles of the treatment, which is treat as much as needed and as little as possible, and consider that the activity of the disease may vary through the time. So in this scenario that we may have a variation of the activity of urticaria, we should avoid some factors that may affect these disease activity, as Dr. Petra said, like, for example, drugs as non-steroidal anti-inflammatory drugs. So if you see that your children may have an exacerbating of their urticaria when they use, for example, some kind of drugs like ibuprofen, you should avoid this kind of drugs when they need some kind of treatment for fever or even pain. Another exacerbating factor that should be avoided may be food, as Dr. Petra already showed you. However, here we have a tricky situation because some children may have like a true food allergy with positive skin testing and positive laboratory testing, which is a different diagnosis. And some children may have both, like chronic spontaneous urticaria and also a food allergy. But some children may experience an exacerbation of their urticaria when they eat some food ingredients, for example, additives or dyes or maybe conservatives. And this kind of situation we call pseudo-allergic reactions. And in this case, when we have doubt if there is some kind of food that is triggering or exacerbating their urticaria, it might be good to go for a restriction diet for a short period so we can check if in this period the urticaria gets better without this kind of foods. However, we may remember that these pseudo-allergenic reactions are frequently due to processed foods or even candies, and we should avoid this kind of food that are not very nutritional. So we must remember that a good diet is every time the best option for the children. Another exacerbating factor, of course, is infections. And we know that especially younger children may experience a lot of viral and bacterial infections during their life. And in this moment, their urticaria may get worsened. Also, we have stress like an exacerbating factor. And of course, those children that have chronic inducible urticaria, for example, may experience an exacerbating period when they get exposed to the trigger that is related to their chronic inducible urticaria. And at last, but not less important, we need to take care of the skin barrier of this child with quick bath with cold or warm water. We should avoid hot water so the skin don't get too dry. We must remember that dry skin usually causes more itch than a moisturized skin. So the bath influences a lot this kind of skin barrier. We also should not use body sponges in these kids because it might trigger, for example, symptomatic dermographism. So we should avoid this kind of practice. And also we should remember using hypoallergenic moisturizers, especially after the bath, and use age-appropriate sunscreen. So as you could see today, the CSU effective management is actually a sum of different strategies. But if we follow these 3 steps, we may have a good management of the chronic urticaria. So remember to use the prescribed medication for your children, avoid exacerbating and recognizing this kind of exacerbating factors, and take care of skin barrier. Thank you so much. I hope I have helped you with these tiny tips about the management.
Thank you, Larissa. Great talk. Again, I invite you all to write your questions in the chat, and we will discuss these shortly after Caroline's talk. The screens are yours.